Good afternoon. My name is Natalia Gerasimenko, student APRN, and this is a presentation for collaborating physician. Miss A is a 25-year-old Hispanic female with no past medical history, comes to the office complaining of severe headaches that she started to experience 1 month ago. Patient states that headaches happen 1 to 2 times a week and last for a few hours. The last episode of headaches started this morning and still present. She reports a throbbing pain 10 out of 10 located at the forehead, and it radiates to her eyes with a pressure-like sensation. Headaches are always accompanied by nausea. Light and loud noises make it worse, and laying in the dark, quiet room makes it better. She did not try any medications to help with her symptoms, but would like recommendations on pharmacologic and non-pharmacologic treatments. Patient reports experiencing a lot of stress lately related to her new job and her family situation. Patient doesn't have any prescribed or over-the-counter Patient doesn't take any prescribed or over-the-counter medications and supplements. Patient doesn't have any allergies to latex, food, medications, or environmental. She denies smoking, using drugs or alcohol, and no recent traveling. Family history is significant for a mother's chronic migraines. Patient's vital signs are blood pressure 128 over 69, heart rate 67, respirations 16, oxygen saturation is 100 on room air, and her oral temperature is 98.4 Fahrenheit. The review of systems is positive for light and loud noises sensitivity, nausea, fatigue, forehead throbbing pain, pressure-like sensation in the eyes, and is negative for vomiting, fever, history of head trauma, change of mentation, loss of consciousness, seizures, neck stiffness, change in vision or hearing, nasal congestion, sinus pressure or pain, shortness of breath, cough, chest pain, and palpitations. Patient appears well nourished, well hydrated, no acute distress, alert oriented, follows commands, speech is clear, normocephalic, symmetrical head with no visible lesions, pupils are equal, round, and reactive to light, photophobia noted, extraocular movements are intact, no eye redness or discharge noted, the ear canal is clear without discharge bilaterally, tympanic membrane is normal in appearance bilaterally. Hearing is intact in both ears with good acuity to whispered voice, no palpable nodes in the neck. Lung sounds are clear in all lobes, normal heart rhythm with S1, S2 heart sounds, no S3, S4 sounds present, no murmurs, no JVD. Pulses are +2 bilateral in upper and lower extremities with no edema. I'm concerned that our female patient is having a new onset of migraine, a headache caused by the multiple stressors, supported by the family history of migraines and symptoms like severe headache, light and noise sensitivity, nausea, fatigue, pressure-like sensation in the eyes. Differential diagnoses are carotid dissection, sinusitis, meningitis, stroke, and brain abscess. Considering that patient doesn't have any cardiac history and doesn't take any other medications, I would recommend to start her on a low dose of sumatriptan, 25 milligrams tablet by mouth every 24 hours as needed. If the migraine is not relieved or comes back after being relieved, another dose may be taken 2 hours after the last dose. Patient needs to be educated to not take more than 200 milligrams in a 24-hour period. And if any chest, jaw, throat, neck pain, or palpitations occur, she needs to stop medication and call the provider. I would also educate on the importance of staying hydrated throughout the day, not skipping breakfast, avoiding food triggers. Patient can also try cold compress, acupuncture, and relaxation techniques. I would encourage her to keep a headache diary for further evaluation. Referrals, labs, and imaging are not needed at this time, and I anticipate a follow-up with her in 2 weeks to assess the response to recommended treatment and evaluation of her headache diary.